Hello, this is Brian Casey of Casey Insights, and we are here at JP Morgan Healthcare Conference in San Francisco. I've got with me right now Robert Lauritzen. He is co-founder and CEO of Cerebriu. Robert, thanks for being with us today.
Yeah, thanks, Brian, for having me.
Yeah. So, Cerebriu, can you talk a little bit about it? It sounds like it's a fascinating concept.
Yeah, it is. I think so. Cerebriu, we make software for radiology. We're automating the MRI, the advanced diagnostic imaging, so that we can do early on-the-table detection of pathology and personalize the imaging output, making it simpler to use and operate, and potentially faster when in primary diagnostics without findings, and very specific with the imaging output for the radiologist if we have findings.
Okay. Is this like AI based?
It's AI based, yeah.
Okay.
Software. Yeah.
And you developed this or helped develop. You're one of the co-founders of the company.
Yeah.
And where was this first worked on?
Well, it's so there are several questions in that. So we started the company 4 years ago. Mm-hmm. We moved away. We pivoted actually after a couple of years or a couple of weeks, talking to radiologists to look at how we could help clinical practice with the sort of increasing bottleneck, the increasing burnout, and looking at the tendencies either to have short protocols with recalls or have extensive protocols, and doing a lot of over-imaging. Yep. So a lot of time was spent creating images of healthy parts of the body, and reading and reporting on those. Yeah. So we wanted to do something about it with a sort of a lean approach, operational excellence approach. Okay. And this is where we came up and with our patented now technology, and where we're today collaborating with Siemens, integrating our software onto the MRI console of the Siemens machine, so that we can really seamlessly adopt and deploy across the world.
Now, is this something that the clinician will see when they're interpreting an MRI scan, or is it something that's just kind of happening in the background that they may not even notice?
Oh, it actually starts. It's so where we're different than most in this is that we're actually in process. So we're actually on the MRI, the modality itself. So the main user is actually the technologist that's performing the procedure, performing the examination, taking the pictures. And here, really, we're coming with the early findings and the recommended adaptation of the protocol, so that they can make a choice that's sort of autonomous to some extent, but also more confidently providing the appropriate data for the radiologist downstream. And the radiologist can get that data as well downstream, but it's really the main user is actually the tech.
Interesting, because the whole concept of workflow and making technologists work more efficiently is really important right now.
Yeah, it's super important. And there's a huge scarcity of techs, not only radiologists, but actually techs. Yeah. Backlogs are piling up in all hospitals because of COVID. And the examinations are being under pressure to sort of how can we work faster and more efficiently, and not just making the machines faster, because there's, obviously the vendors are looking at how to compress and make the scans faster and more accurate and more specific, but also to downstream avoid the pileup of data.
Yeah, cool. So here at JP Morgan, are you talking to investors? You talking to potential clients?
Yeah, mainly the former. So we have a lead investor raising 10 million Series A. We have 7 million. So I'm raising the last 3 million in cap. Right. Obviously, in the U.S., that's a fairly small ticket, but it's mainly building relations also for coming rounds with investors.
Great.
And hoping to see. So I do have some traction. There's some interest to jump in while the price is good. Obviously.
Sure. Now, what can we see from Cerebriu in the year ahead?
So 23 is our targeted product launch together with Siemens. Hopefully we'll be engaging with some of the other OEMs as well. It's non-exclusive, but we are looking at bringing this from clinical testing, which we're moving into now, into FDA clearance and into the market.
Awesome. Well, Robert, good luck.
Thanks a lot.
Thanks for being with us today.
Well, you're very welcome. Thanks, Brian.
Signing off from JP Morgan in San Francisco, my name is Brian Casey.